Hi and Assalamualaikum everyone. Today's topic is titration in medicine and drugs. This is our group members and let's go to the next part.
Hi and Assalamualaikum everyone. My name is Nurafar binti Zakaria and my metric number is 20224834 and 32. So today I will explain to you guys about what is volumetric analysis and the relationship between the titration. So what is volumetric analysis? Volumetric analysis is a method of quantitative chemical analysis where the amount of a substance is determined by measuring the volume. So in this topic, there are several types of subtopics, but today main topic we will use titration. So what is titration? Titration is laboratory technique used to determine the concentration substance which is analyzed by reacting it with a solution known of concentration, which is titration. Scientists and laboratory technicians use several different types of titration for wide variety purposes, such as developing medicine and diagnosing disease, which is our main topic. However, the main principle behind titration is same as everything, which is about achieve chemical balance, neutrality, and certain level of concentration. In all the cases in this way, titration is done through the gradual addition of a solution with a known concentration to a solution with an unknown concentration. For the example, bacterial acids are considered titration because of the gradual dilution process involved in the titration process. Typical chemical indicators are used to determine the endpoint of the titration process, but this can also be chemically computed based on a certain parameters like a molar that we need to be calculated in. Precision instruments like pH meters and calorimeters can also be used for the purpose of determining the endpoint of the concentration, which is the level of concentration, and which is, as I said before, is about achieve chemical balance. So back to our main topic, which is I will explain about titration in medicine. Titration in medical context generally refer to the careful adjustment of drug dose to achieve the desired therapeutic effect while minimizing the side effect of it. The process involves starting with a low dose and gradually increasing it until the optimal dose is found. This is often done for the medication that require precise dosing, such as insulin for diabetes. As I said it before, starting with a low dose, gradually increasing it based on blood glucose level to avoid hypoglycemia and hyperglycemia. The second one is antidepressant, gradually increasing it to thus find the right balance between the efficacy and the side effect that might affect the patient who take it. And the third one, which is the last one, antihypertensive, adjusting the dose to control blood pressure without causing hypertension towards anyone who take the prescribed.
Next, we have types of titration. First, we have direct titration. Direct titration is the most basic titration which is commonly used. In this type, a titrant of non-concentration and volume is added to a substance in order to analyze it. Second, we have back titration. Back titration is used for determining the concentration of an analyte. It includes the process of reacting of analyte with mole of a particular excess reagent and thereby titrating this reagent with a second reagent. Then we have the methodology of titration. First, we have to prepare the titrant and the solution to be analyzed. Secondly, we have to slowly add the titrant to the solution until the endpoint is reached. Lastly, we have to do the calculation. We use the volume of titrant added to calculate the concentration of the unknown solution based on the reaction.
1. Using the pipette, add a set volume of the unknown solution to a clean conical flask. 2. You may also need to add a few drops of indicator. 3. Fill the burette with a known solution. 4. Record the starting volume on the burette. 5. Slowly add the solution from the burette to the unknown solution in the conical flask. You may need to swirl the flask to mix, or use a stir plate. 7. Stop adding when the reaction is complete. The endpoint is reached. This is where an indicator may help because there would be an appropriate color change. 8. Record the final volume. 9. Subtract the final volume from the initial reading. This gives you the volume of the solution added. This volume is called the titer. 10. For an accurate experiment, you should repeat this experiment a few times until you get consistent values for the titer.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Amira binti Effendi. I will explain you about this slide. This slide shows experiments result from the left experiment. The type of titration will involve its back titration. From the result, show that the example was repeated for. Next, this slide shows a data that a correct dose for making medicines or drug. This is a way to limit potential side effects by taking time to see how your body will react to a drug. Some examples of the type of drug commonly requiring titration include insulin, anticonvulsant, blood thinners, antidepressant, and sedative. Drug titration is also used in phase 1 of clinical trial. The experimental drug is given in increasing dosage until side effects become intolerable. It is a clinical trial to find which is suitable dose for body and the correct amount to use it.
Medication titration is a collaborative effort between doctors, pharmacists, and other healthcare professionals. Each professionals play a crucial role in ensuring the safe, effective titration of medication. When it comes to medication titration, doctors are at the forefront of the process. They were responsible for prescribing the initial dosage of medication and closely monitoring the patient's response. Doctors carefully evaluate the patient's symptoms, conduct regular checkups, and make necessary adjustments to the dosage. This requires a deep understanding of the patient's medical history, potential drug interactions, and any underlying health conditions that could impact titration. Furthermore, doctors take this into consideration the patient's overall well-being and lifestyle factors that may affect the medication efficacy. They assess the patient's diet, exercise routine, and stress levels to ensure that the medication titration align with the patient's individual needs. By taking a holistic approach, doctors can optimize the titration process and maximize the benefits for the patients.
That's all from us. Thanks for watching.